All right, we are live. Good afternoon. Today is October 23rd, 1 week to Halloween, Friday noon. This is our weekly call, weekly live session with from United Medical. As we discussed earlier, we are trying to bring our different physicians from our own group, as well as different uh, stakeholders in Delaware who are actually helping us going through this difficult times that we have. Today, I'm gonna go ahead and start sharing my PowerPoint. Um, all right, so we are uh, we are hosting our state directors today, and Dr. Rick Hong is here with us, and then we are going to have Dr. Pescatore, who's going to join us probably in the next couple of minutes. So he's running a little bit behind with his other meeting, but we have Dr. Hong right now. And also, I asked one of our directors at United Medical ACO, Anthony Onugu, who's also with us. So I'm gonna start with Anthony first. Anthony, if you can please introduce yourself, and then we'll have Dr. Hong introduce himself, and then we'll start the rest of the agenda.
Thank you, Kemal. Good afternoon, everyone who's here with us, who's joined us. My name is Anthony Onugu. I'm the Director of Contracting at United Medical ACO. And I'm happy to be here on Friday, the 23rd.
Thank you, Anthony. And Dr. Hong?
Yes, my name is Rick Hong. I am the State Medical Director for Division of Public Health within Delaware. I'm board certified in both emergency medicine as well as EMS. My colleague, Dr. Pescatore, probably won't be able to join us. He had a conflict, but I'll be happy to entertain your questions.
All right, no problem. So Dr. Hong, what we do in these sessions, I don't know if you were able to watch any of them. First, we started with our internal physicians. As you know, we have about 160 in Delaware, maybe a little bit more. Then we have Humana actually joined us. And after Humana, we have DIN CEO, Dr. Jan Lee. And then last week, we have Senator Brian Townsend was with us. So then as we are trying to make this more beneficial for everyone, our goal is to make sure that we can provide as much update as possible. And I know you are doing a lot from your side, from your office, but we wanted to make sure that our specific patient population that we manage, we can give them the most accurate, up-to-date information. So usually I start with this comparison from April 15 through today, just so that people can see the dramatic increases in these numbers side by side. So right now we are about 8,675,000 and 199 total confirmed cases. Number of deaths, we are at 228,577. This number to the comparing this number to 6 months ago, it is about a little over 4 times more, and 8.6 times more for the confirmed cases. It's pretty dramatic increase here. Now, one of the issues that when I'm having our provider meetings, we started with the daily meetings. We went to 3 times a week, then now we are doing 2 as everyone is more up to date with everything. But I still share the number of cases the last 2 days from Worldometer, last 2 days and last yesterday. So the first one here is 2 days ago with 64,000, and yesterday in USA total is 74,000. I think this is one of the highest days, I believe, with the total numbers. And these are important from the time of the how we are actually managing and how we are reacting to this. And in Delaware, we had perhaps a little bit different picture where our numbers overall were much better. And we are also sharing these numbers, Dr. Hung, with our providers and our patients as well, as we're getting them directly from you, from your website, from the state website. Now, you probably heard this before. I do criticize time to time with our total number of tests, average number of tests. And I believe this is one of the reasons that we have, where we used to be, about a month ago, we used to be around US average. And then now we are actually 7, 8 down from the US average in terms of the different states. So average, we were at 388,000 in the United States in 1 million, tests in 1 million. And then the Delaware is at 339. Now, I don't know how you process some of these, but every time Delaware has some numbers, what we do internally is just look at what Rhode Island's doing, because that's just the closest state in terms of their total numbers and how small they are. So, and then they were doing so well, and they actually got even better in time. And now, do you believe there's some, are there some reasons for us to be behind with the total number of cases, total number of tests, or the plan is, do you have any plans to increase that number in time?
So I always have to preface any data to find out what the setting is. So tests come in many different forms. There are PCR tests, there are antigen tests, there are antibody tests. So, you know, for the CDC, they're only counting PCR tests. I can't speak on other states. Are they counting other tests as well too? We tend to report what CDC is doing. So we're only reporting PCR. Also, the number I'm looking at, 339, if you look at My Healthy Community, the total tests being listed today is 522,612. So just kind of share some information. We recently updated our My Healthy Community data. We used to report persons tested, which did not count for repeat tests for the same person. Because of our testing capacity and where we're at, many people are getting tested multiple times. So that number may be more persons tested and not total tests being done. But based on My Healthy Community, we are at 522,612 total tests done so far. And that's PCR only.
Okay, that actually is helpful, because the way that we are getting these numbers, I think there's some updates that you guys have done last week. Anthony did actually bring that up in our provider meeting, the way that number is being reported. That was helpful, but knowing the total number also with the different types of tests you are seeing, right?
Yes, that's correct. So, you know, we decided to add the additional metric. Before, we were reporting cases or persons tested and percent positive cases, because of the fact is we want to know what percent of our population is positive. But now, because that we are at a point where we have so much testing available in Delaware, we need to take into consideration those that are being tested multiple times. So if you look at percent cases, if you're tested 5 times, you only count you once, because you're one person or one case being tested. That did not help us determine whether we are doing well with testing. It does not determine where we need to do more testing in certain areas in the state. So we added the new metric, total tested, total test provided, as well as total positive tests. That kind of allows for the consideration. Someone could get tested 5 times. We count that person 5 times because there's 5 tests being performed. So I think both metrics are important to help gauge what kind of response we need in terms of testing.
So right now, the weekly number, Dr. Hung, the 80,000 that I was sharing earlier, is that the number that you have on your side as well?
So 80,000 is what the federal government advised that we should be doing. I did some preliminary values or calculations on how we're doing per month, and we've been over 80,000 per month since June.
That's good to know.
Yeah, that's very good. So I really appreciate all the partners. It's not just DPH, you know, there's other state agencies involved, as well as hospital partners and community partners. So really, it's really an entire state participation getting our numbers as high as they are now.
I see. Anthony, did you have any additional question on this topic?
Yes, in terms of how does that reflect vis-a-vis the contract you have with Curative Inc. and the targets that you set within that contract?
So the contract doesn't say 80,000 per month. That 80,000 is total testing in the state. There's no contract that says 80,000 from Curative. The Curative is a big significant factor in why we're doing so well with testing.
I see. What's the current turnaround time for tests as we speak?
So it depends on the test being done. Many labs are involved in the testing process. So from curative perspective, we're seeing on average between 48 hours to 72 hours. At the state lab, we're also seeing similar times. I'm hearing anecdotally there are other commercial labs out there outside of Delaware that unfortunately is longer than the 3 days or the 5 days that we're seeing in Delaware. So a tough question to answer. And that's why it's so important to consider the rapid test that we are seeing now in the state. We've had rapid antibody testing early on. Now we have antigen testing available, and of course the Abbott ID nows that are rapid POC PCR tests. So there's always some trade-off between rapid turnaround time and accuracy, but I think we do have a great mix of test modalities available to really help us respond appropriately.
And you're counting the testing in the schools as well. That's part of the number you have.
Or PCR tests.
Okay.
Oh.
So, Dr. Hung, from the time that we started, our immediate reaction to the crisis management was we want to make sure that we have provided the updates to our providers. These updates, other than what's happening outside of our offices, it's more about how we are managing the patients. And what you see here is the number of appointments we have since March 16th. United Medical ACO had about 406,000 appointments. That's a little over, I believe, 100,000 individual patients. So we heavily educate our providers to pick up the telemedicine. But this number is a big number in terms of what we are doing from our side as a single private ambulatory group. Now, we also give them, time to time, actual comparison of like the first 2 weeks of March, where we had like 30,000 appointments. Then if like this was prior to the COVID, and so that's kind of like our baseline. And then what we can do after that last 2 weeks of June. So it was a little bit lower, but then last 2 weeks, first 2 weeks of October, we are at the same number that we were prior to the COVID. So I'm happy to report this so that we are actually doing the management of it now. And I was hoping that because we do so much of this 406,000 appointments on telemedicine, and I believe this is going to have some impact on our projected flu numbers, because those patients are not actually necessarily leaving their home to come to our offices. Now, you just wanted to get your feedback on the flu season, your guidance on the flu season, what practices should be doing, what our patients should be doing during this time, and the use of telemedicine. And then we discussed it with Brian Townsend, where we really are pushing telemedicine to be long-term as the big vehicle for us to be able to manage these types of patients even after the COVID. What's your position on these?
So for the first question, I mean, this is a very good question because we are concerned and really not sure how the flu season is going to impact the pandemic. One of the challenges we are seeing or anticipating seeing is that flu presents very similarly to COVID-19. So I think we're going to see a lot of concerns, people with flu-like symptoms thinking more COVID than flu, and I can anticipate that there might be an increase in number of visits in the outpatient setting, to kind of tease out whether this is flu or COVID-19. So I anticipate there's going to be more interest in testing. I just want to make sure that the public still remembers flu is out there every year around this time, that don't forget to get your flu vaccine, and that providers should consider testing for flu if it meets a case definition and not just worry about COVID. There's always concern about co-infection between with COVID as well as flu. And I anticipate that could be a worse outcome. So, it's so much more important to get the flu vaccine to reduce the risk of co-infection as well as misdiagnosis of flu versus COVID-19. So a lot of things we anticipate on happening as we move on. We'll have to wait and see what our experiences are.
I see. Now, in terms of just to take this, going back to this 7 months ago prior to the pandemic, and there are so many discussions these days. I don't know if you were able to go through the whole debate last night. Overall, it's always painful to watch. Now, could we have done something differently, or could we add something to this? And I'll just tell you why I'm asking this. I personally believe that we could have done more from the outpatient side, because one of the reasons that I'm sharing the numbers with the really big total numbers that we are managing or we have access to, initial reaction or response center usually is kind of like the hospitals in these cases. But from our side, hospital is the last resort, because we want to try to avoid any type of hospitalization. Now, and I think there is this chronic problem that I see personally. I see that every time there are these types of issues, I don't know if the outpatient private practices are well engaged. And then I was thinking that would be one thing that I could probably do differently. Do you agree with my statement or my opinion, or do you have any other thing that you would do differently if you were to go back?
It's always a tough question, and I'm very critical about what we do, because I think we can always do better. So yes, we could have done better. How we could do better, I think, in multiple fronts, not just within DPH, but also within our partners. And as we are seeing an increased number of cases again, whether you want to call this round 2 or not, I'm hoping some of the lessons learned from before in the spring, we're going to do better at for this time around. So when you talked about ambulatory offices, I think there was a lot of concerns and fear out there because of the lack of information regarding this virus. We now have a better sense of what we're dealing with. So maybe that fear factor is not as prevalent, and maybe offices would feel more comfortable staying open, though I don't criticize for them staying closed initially, because we didn't know what was going on. So we want to make sure that we protected our staff, protected our patients, other patients as well too. I'm hoping that more information that we have available will allow us to react more consistently what we should be doing. So a good example would be emergency operations plans. This is something we did speak to a lot of our partners. Do you have an emergency operations plan? Do you have a continuity of operations plans? What if you have to close your office? How else can you provide services if your office is closed? How else can you provide services if you don't have the staff? Things like that, I think, are important to be able to maintain services to the best of our ability. PPE supply was also a concern. Will this allow us to be more prepared with PPE supply, given if the supply chain is where it should be? So I'm leaning towards the offices to see, have they considered more about infection control measures, processes in place, operations, throughput to help reduce potential transmission of infection. And I think telehealth was a wonderful thing that we're seeing. Many offices were not doing telemedicine, telehealth, and now they are. And I think that really expands the services available given the situation we're seeing now.
So I think around the issue of telemedicine, and just to kind of revisit this issue on how we are actually managing the telemedicine side. So our immediate plan of action was, we want to make sure that they have technical, hardware type of stuff. Everything was given connection-wise. They didn't have any problems anyway, because we are using the EMR for a long time, and all the offices have the highest speed internet. Having the doctors set up at their home, just like if they were in the office, and we utilize, as you may know, Cerner Power Chart, and then there's some new modules that we adopted just recently, which makes the telemedicine experience a lot better. But one of the other things that we did with our different specialties that we have, as you know, the biggest bariatric program is under United Medical ACO with CRIAS, Christiana Institute of Advanced Surgery and American Surgery Center. We were doing a lot of webinars for the patients. Before we were doing seminars and then webinars. And then one day, Dr. Isaiah Ergal, he's the co-chair of United Medical ACO and the president of CRIAS, when he said, I want to do Facebook Live. So I'm like, what the hell? Like we are doing enough already. And then, no, he said, come on, we have to be able to reach out to the patients. And I'm like, first I wasn't really happy about it. And then I'm like, okay, so this is what's missing. Like, we are not really reaching out to patients outside of our visits, especially when the offices are closed. So then with the help of that experience that we had from the bariatric program, I took that to a next level. Not only we did what we are doing with the bariatric program, but we added like this session for us to be able to outreach to the patients and make these YouTube channels available for the patients. From the time of this is our 13th session, so getting the people ready, getting different resources available for our patients, and then in the meantime, we have the diabetes center as well. We are accredited diabetic group, I guess. Anthony, you may say that better. So that group actually started wellness webinars. So then these, as you can see on the over here, Amy Wilkerson is our head dietitian there with the program, and we started actually having these additional events for the patients. So they're available offline. Right now they can watch us live, but after this is done, it's going to be posted again. There are certain things that's available for patients, and I want to make sure that other practices are also taking advantage of these, where my biggest fear, Dr. Hang, in this situation is telemedicine is the blessing for today, but it has to be done at certain standards. So I don't want not only just providers, but I also don't want patients to take advantage of it in a bad way. So the standard needs to be kept at certain level. And that's why we are trying to actually take this to a next level. And Anthony, you may want to say more on this one, where the term that we start using is integrated digital health. And this, our social media outreach is part of the program now. Now, do you plan to have any additional sessions from the state for the patients, or what do you think about these activities?
No, I think it's a great idea, and that, I'm always looking at positive, and I know this has been such a tremendous burden for everyone in all aspects, but we are developing different processes, procedures, technologies, products that I think is going to benefit us after the pandemic, and I think telemedicine is one of them. I think there are opportunities how we can support offices and practices, regardless whether it's technical assistance or whether it's reimbursement. That's not my specialty, but that's something we have discussed at the state level, what we can do to provide that additional support to allow ambulatory offices to provide this service. I think this service is a great service. I agree there needs to be standardization, but also there are opportunities to even do better than that. And I think that we have to make sure that the quality of care that's provided through this modality is as close to as possible to an office visit. I know that's not possible, but we can do the best we can. And I'm very interested in seeing new technologies, as in other technologies involving other aspects of healthcare.
I would add quickly, Dr. Hung, that there are substantial opportunities to engage especially primary care practices. As you know that early on, there was a lot of concern about safety of healthcare practitioners, and most of that's changed as we've come to better understand the virus. And there are opportunities. On the CMS side, one of the things they did was some flexibility in the reimbursement system to actually reimburse for patient education around the virus, on the importance of social distancing, wearing of face masks. And I thought that there was opportunity for the state to do something similar, distribution of face masks, hand sanitizers at the provider and practice level. A couple of weeks ago, one of our providers was in this same session. And in our discussion, we did make the point that a number of test slots at the various testing sites continue to be available and unused on a regular basis. And at the same time, we have primary care physicians who see patients on a day-to-day basis as part of routine care. If a refocus around primary care providers in terms of using them to promote regular testing by patients, especially now that at the state level, you have the capacity for this, right? And the more you have, more you have people engaged in testing, more than likely the positivity rate is going to decline even further. I don't know what you think about that.
So we're always interested in working with our partners, but this is something that we need our partners to also participate in the process. We've had interest, but when we provide the necessary resources, then the interest goes down. So I'd be happy to work with any provider that wants to be more engaged in testing, but there are also some regulations involved. There needs to be CLIA waivers involved. There needs to be a provider that order involved. So I need those to be in place. The state can't own all this stuff. So once I kind of explained, do you have a CLIA waiver, which is something I can't bypass, many offices do not have CLIA waivers. So they already cannot be part of certain testing modalities we have out there. We can support as much as we can, but we do need the providers as well as the offices to provide resources needed to make this possible. So I'm always open and engaged to hearing what opportunities are out there, but the state cannot own everything. We're not expertise to own everything. So we want to be interested in partnerships with entities that can provide those gaps that we have currently at the state level.
And I agree with you, like states shouldn't have to do everything. And that's why from the beginning, we actually, in this one, just to make sure that I recognize what Anthony has done, we are keeping the providers together from our side, so that, in fact, at some point, this crisis became more like an opportunity for us for the future of the for the healthcare, and then how we are providing the care, what we are doing for our patients, how we are changing and adapting very easily, very quickly. And I think our providers have done so much, and I do want to also acknowledge what they have done for us. Now, the one last question on the school numbers, Dr. Hung. Are they now, after the 6 weeks, are they going to go back to regular, in-class teaching?
So depending on how we're doing with our metrics, and currently we've been in the yellow for quite some time, which means that we are recommending a hybrid process. So there's some schools who have decided to start some in person. Others have decided to start remote and work their way into in-person. So we are working closely with the school districts and the schools to determine what best fits for them. I understand there are local deviations to what the state metrics show, and we do realize the importance of that in the decision-making for individual schools.
I see. All right. Well, before we close, I do want to actually show what's coming up for next week. So we have 2 meetings for public. On Wednesdays, we have a 3 p.m. meeting with CRIAS, and then on Friday at noon, we have our United Medical ACO meeting. That's going to be at the same time, and we are going to keep doing a better job and try to improve. Now, Dr. Hung, I know you guys are working a lot, and then you were able to make yourself available for this meeting, and I do appreciate that, and thank you for being with us again. And then anything that we can do for your office, the partnership collaboration, we are here to participate, as we are already doing with some. But thanks so much again. Any closing comments that you would like to make?
No, and I appreciate this opportunity because I think we can always do better with communication, not just with providers, but also with patients. So I'm interested in sharing information and also making sure the public realizes we do have public-facing communication on the website. We do have a coronavirus website they can look at. It'll give you information about just coronavirus in general, also give you information on testing sites. We have partnered with Walgreens, and right now I believe we have 8 sites that are currently open that are working closely with us to provide testing, and that has significantly improved access. So even if providers cannot do testing at their sites, they can also remind folks to refer them to some of these sites that we have listed. There are many sites available. You can look it up through zip code, location, which is, I think, very helpful. I think we need to continue to educate providers the importance of testing, and especially with flu season, to not forget about flu and to push for the vaccine. So I think this is a wonderful opportunity to communicate to providers on what's up ahead with flu season.
All right. Well, thank you so much again. We'll see you soon for another event, hopefully. And Anthony, thank you for joining me also. We'll be back next week on Wednesday and Friday, same